Hi there, this is me giving you a quick demo of your new vaccination template for flu, pneumo and shingles. So this is what it looks like. On the left hand side here you've got useful information, things that you'd probably normally be checking with patients. So green tick suggests everything's fine, so they've had the flu vac previously, no record of adverse reactions to the flu jab. Something that you might want to stop and consider is that this patient is on high dose steroids or immunosuppressants, and you can see then below here the details of those. No record of egg allergy, not on anticoagulants. Similarly, if there is more information here, like if there are on anticoagulants, it would show that here too. You can see where the PSD has been coded this season. That's not been done yet. Vaccinations in the last couple of years and vax to offer, so it would also show shingles and pneumo if they were applicable. Here you've got some drop downs if you do want to record anything. You don't have to record no, because when we click to give the flu, it will record those things for us. Similarly with those, but it can be useful if you want to record that. You've got refusals here. Record flu vac given by another, which we'll come to, and then PSDs. Those are grayed out for me because I'm not a GP, but for GPs you click on any of those and it'll add a PSD for that particular vaccine. There's also a link to PGDs. The main bit then that you'll be using is this give flu, so click on this. What it will normally do for a nurse or HCA is work out, or GP, sorry, it'll work out your role and automatically skip this bit. But because I'm none of those, it's not letting me do that. So first off, if I pick that I'm a HCA, it will tell me that no PSD has been added. So I'd stop. There is an option to continue anyway, if you know that a PSD has been done in some other way, but it's not been done using the system, so I'll stop there. If I pick nurse instead, it's then automatically worked out which vaccine is needed for this patient based on the patient's age. If they're a child, it'll ask you and give you various options. Obviously, you put in your batch number and record those things, and we can OK that. Obviously, once it's set up properly, that won't happen. And then you can see over here, look what's been added. So check the patient's fit and well. It's coded that it's been given under a PGD. Obviously, we coded it was under a PSD for HCA, and then patient given advice. So everything has been recorded that's been needed. You can put extra notes in here. If they're not showing already in the report for those who are entitled, if you're a nurse or a GP, it will tell you that and give you the option to put that in the notes or to stop. You can also see that now we've added the flu vac, it's now displaying that here they've had the flu vac already. In fact, if we tried to give it again, it will again warn us. So there's lots of sort of checks and balances and things to stop here. And then these pages have got similar things, but obviously for pneumococcal and for shingles. Shingles I can't access because this patient isn't in the right age range. This template can be accessed through your toolbar with the icon that looks like a bit like a nurse or HCA with a sort of vaccination next to them, or from the status alert under the patient demographics.